Now that you have selected your feeding tube, you need to know how far to advance the tube so that food can enter the stomach. You can pre-measure the tube by holding the tip of the tube to the last or second from last rib of the puppy or kitten. Keep hold of the tip with one hand and follow the tube with the other hand up to the puppy or kitten's mouth. This is where you need to mark your tube with a Sharpie. Some tubes have numbered measurements along the tube, so alternatively, you could remember what number up the tube their mark is. You should not use tape to mark your tube, as this cannot be sterilised as it stays damp and harbours bacteria. You should re-measure your tube every few days as the puppy or kitten grows. Prepare your formula in the same way as you would for syringe or bottle-fed neonates, and fill your syringe, making sure there are no air bubbles. There will be air inside your feeding tube, so you want to attach your syringe to the feeding tube and flush the formula through until you see formula flowing out of the tube. I always make sure that what's left in my syringe is what I need to feed, as I find if my syringe has more formula than what is needed, it can be hard to remember when to stop, which may result in giving too much formula. This is just a personal preference. Make sure your puppy or kitten is comfortable and in a natural feeding position. Some rearers find wrapping the puppy or kitten in a blanket and placing them into a mug leaves both hands free for tubing and helps the puppy or kitten to feel more settled. I just have mine on my lap with a blanket, and puppies will usually suckle my finger, which settles them. Kittens can be a bit trickier to settle into tube feeding, as they don't tend to suckle on human fingers. You don't want to restrain your puppy or kitten, as this will not make them feel relaxed and ready to feed. Instead, they may start to wriggle and feel panicked. Allow them to root and with one hand, gently support either side of their head and use a finger each side of the jaw to apply gentle pressure to open the mouth. Make sure you are not pulling their head upwards, as this will open their airway, increasing the chances of the tube going into the trachea. Instead, you want the head in a natural position, or slightly downwards. Then you can place the tube inside the mouth. Sometimes it is at this point that you may notice them trying to swallow the tube. This is encouraging, as if they are swallowing, the tube will naturally be guided into the esophagus. Let them swallow the tube and gently guide the tube down to your pre-measured mark or number on the tube. If they don't swallow, aim the tube to about 3/4 along the palate and slightly to the left-hand side. If you feel resistance, the tube may have hit the side of the cheek, the back of the jaw, or the trachea. Pull the tube back and try again. You should be able to smoothly advance your tube, and be aware that if your puppy or kitten is fidgety, the tube may not feel as smooth, as they could be kinking the tube as they are wriggling. Once you are happy that you are at your pre-measured mark of the tube, take a moment to look at the neonate before you start feeding. Are they breathing normally? Are they nice and pink? If you are unsure about your tube placement, you can pinch their ear or toe. If you can hear them cry, then your tube is definitely not in the lungs, and you are safe to tube feed. Then you can slowly depress the plunger at a slow and steady rate of around 1 ml of formula to every 10 seconds. I always pause for a second after administering the first bit of formula to check that there is no coughing. Once fed, pinch the tube to avoid any leftover formula dripping and swiftly remove the tube. Allow the puppy to suckle your finger, as this reduces the risk of regurgitation and helps them to fulfill their nursing instinct.